Thank you very much, and good morning, everyone. I'm going to start with some definitions, because during the day we'll hear two different approaches to thinking about the social determinants of health. And this is not an attempt to be the language police, but to, in fact, just clarify that there really are two different concepts here. One concept, the one that you see on the left, is the notion of non-medical social needs. These are the individual needs of patients to address such things as food insecurity and housing instability. And they are resolved often, or they can be addressed, or at least referrals can be made to individual patients to try to address those. That is distinguished from this particular definition of social determinants of health, which is more about changing the conditions in the larger community and thinking more about what are the underlying or more root causes of some of those social and non-medical social needs that were just mentioned, such as inadequate housing availability in the community, non-affordable housing in the community, limited access to food that may be related to income or discrimination. Now, again, you'll hear during the course of the day, we'll refer to social determinants of health, meaning the non-medical social needs, but it is important for us to try to distinguish between those two because they're different approaches that are necessary in terms of addressing those. Now, to change the slides, do I have something to do that? Okay. This is just a visual representation of that. We sometimes refer to upstream and downstream. In this instance, when we're talking about upstream, we're talking about the social determinants, the root causes, working at that total population level around a law, a regulation. And when we're talking about midstream, we're talking about those individual patient-specific social needs. Next slide, please. Oh. Okay, great. Oh, thank you. So this is a representation of the notion that we have to work at multiple levels at the same time, but individual institutions, agencies, sectors may be focused more on one aspect of the work than the other. In this case, you see 4 columns. The first 2 columns are pretty much exclusively those that might be thought of as the healthcare sector. They involved screening patients for social determinants of need. We're seeing a great example of that with the accountable health communities. And then the second column is referring people. And there are examples of that, health leads and others that make those referrals and help in terms of patients linking up to services in the community. The next 2 columns, though, represent things that can be done with support by the health care sector, but really with a lot of work by other sectors. They include making sure that at the community level, you have a housing agency or a food agency that's prepared to offer some of those services, sign people up, address the needs. That needs to be funded and it needs to be mobilized in order to link up to the healthcare system, as you've heard from the Admiral and from the questioners. And then the 4th column is the changing of laws and regulations themselves. For housing, that might mean a law or a regulation in a city that says for every 100 housing units that are built, 10% of them need to be affordable, for example, or conscious decisions around eliminating segregation in housing. Now, the good news is resources exist for those larger population level changes, what I was referring to as the social determinants of health. We're going to be talking, I think, a good deal about the pilots that are occurring now with support from CMMI and Kaiser Permanente and others, where there's work being done to think about the role of the healthcare sector. Sometimes thinking about those laws, regulation changes can seem too overwhelming and hard to understand and to think about, is there an evidence base? There is, in fact, a variety of materials that are now available that can help you with that, including one that Trust for America's Health just released, Promoting Health and Cost Control in States, focuses on 13 evidence-based policies, High Five at CDC, and City Health an initiative by the de Beaumont Foundation focuses on what cities can do to change those policies to complement what happens in the healthcare sector. And these are just two examples of those that are mentioned within those materials that have an evidence base. If you pass these policies, there's a direct correlation with improvements in health. So finally, my comments would be, there isn't one solution. We need to mobilize multiple sectors. They need to be around the table together working. We need to make sure that the resources exist in other sectors. We're going to focus a lot on the resources coming from the healthcare sector and insurers today, but there also needs to be money for community investment, for housing, for combating segregation at the community level, for building economic security and educational opportunities. Those are important complementary approaches. We can't forget those, even if we focus today more on those first two columns. So thank you very much.